morning. We're happy to be with you today. The main objective of this press conference is to provide a more formal response to the announcement that was made yesterday, but to also allow the press and therefore the community who they represent to ask questions, and so that we can give the most up-to-date scientific answers. And therefore we have Dr. Jones with us, not in person, but as you can see right behind me, who will be able to provide this response and answer your questions. We also, would like to give you the opportunity to ask general questions regarding COVID-19 in case that you may have some, so that we can answer them to the best of our ability. So I'll let Dr. Jones speak. Go ahead, Dr. Jones.
Everyone can hear me well?
Yes.
Okay, so listen, I really want to sympathize with the community because I know that this was a bit of a bombshell. It was a bombshell for the community members, but it was also for us as the treating team and the whole hospital community. And so I know that Lisa did do the press conference, and I did send out a memo to the community that'll be posted on our social media platforms. And we do, at that point, you have to remember that we were in sort of crisis mode, trying to get the information out as quickly as possible. And inadvertently, I may have contributed to some questions. It may have contributed to increased anxiety. And so this is what I'm going to do today. I'm going to try to be brief, but I think it's important that I give as much detail as possible, and that I give them as many facts, so that by the end of this interview, at least I want the community and the community at large, but also the hospital community as well, to feel reassured that we are in the right place, and that the bottom line is that we dodged the bullet, and seriously, and this was a close call, but at the same time, it's a wake-up call. So I'm just going to briefly go through some of the points in my letter that may have caused a little bit of confusion, and I just wanted to give a little bit more details, and then kind of give a bit of a background of the excellent team that we have in the hospital, and that we have joined forces with the community of Kahnawake COVID Pandemic Task Force, and this community is extremely fortunate that you have cross-organizational, cross-community buy-in. We're all on the same. We're all on the same playing field. We all understand the seriousness, and we're all working tirelessly. People are working the long hours. Have worked on the weekends to provide change in manners and practice services, safe manners and practice, safe and to have safe access to healthcare. So I just wanted to bring up. There's different points that people sometimes might misunderstand in terms of how contagious you are versus being in an incubation period. So an incubation period is when you might have picked up the virus, but you're not actively ill, and you're not actively shedding the virus. And so for many different kinds of viral diseases, the incubation period can be for sometimes, like with the flu, it can be usually it's within days, and it can be up to 5 to 7 days. So that means you carry the virus, but you're not a danger to anyone. So that's called the incubation period. Now, what we know for some viruses is that some viruses shed a few days before the patient actually has symptoms, and so. So there are different charts that we sometimes will look at depending on what kind of virus that that is showing up. So there's common childhood diseases that people can understand, and they can relate to that. But with this particular virus, it's a coronavirus. It's in the same family as the common cold, for example. There are thousands of coronaviruses, and so what is different about this one is that it's a brand new virus. None of us have been exposed to this particular virus. And so that's why technically every single human being on this planet is at risk of picking up this virus. The great mass majority of people are going to have very mild symptoms. Our physician in question had very, very mild symptoms. And I think people have to understand that. So any community members who might be at risk and have very mild symptoms, pay attention. You might just have a bit of a sore throat, a bit of a cough, not feel a bit under the weather. If you have a history, a travel of history, and now we're having to rethink, so we were saying 14 days back, so maybe we need to reconsider maybe 3 weeks back, but definitely since March the 12th. If you've had any travel history outside the province of Quebec, and you start to having symptoms, even if they're mild, you need to call the hotline to be assessed and to get some testing. And that number is 1-877-644-4545. And this number is widely spread out on all of our communication platforms, MCK platforms, etc. So that's important to remember that kind of number. So the other issue, the contagion.
Dr. Jones, before you continue, do you mind if I summarize then the difference that, and please let me know if I'm paraphrasing correctly. So what the difference and what we saw a lot of questions and comments about is there's an actual difference between the incubation period, which experts are saying is 14 days for this virus, and the contagious period, which is similar, which they're saying is showing similar signs to the common cold virus, which is 24 to 48 hours prior to. So we just want to make that clear that there's a difference between those two elements. Okay.
So I'm going to. So that's where some of the misconceptions have come up. So with this particular virus, we think that you're contagious in the hours before you start to have symptoms, and so the 24 to 48 hour period, we actually cannot find any documentation that actually has linked this virus to this kind of period. However, we know that coronaviruses typically will have this potential risk of shedding 24 to 48 hours. And so when we did our case study of this particular exposure, we used this worst case scenario. Well, what if it was 48 hours before these symptoms, and then we backtracked and counted the days, and that's how we were able to conclusively say, without any doubt in our mind, that nobody in the community has been exposed. And none of our staff have been exposed to the coronavirus based on this information. And one of the questions from Facebook said, well, why aren't we backtracking a 5, 6, 7 days, 8 days, 10 days? Well, because there's no evidence, there's no indication that is the case. And I did state that we don't know much about this virus yet, but there are some things we do know. So, you have to remember that the whole world we have the top specialists, they're all working together. There's no more boundaries between, what country you belong to or what university you belong to. They're all working together. And the Chinese people have, in the Chinese experience, in the Korean experience, they have provided valuable information. Unfortunately, what's going on in Italy is providing valuable information about what not to do and how and why we are in this situation. I'll come back to that a bit later. We're going to be posting this information also on our page.
I'm sorry, I keep cutting you off. It's hard when you're not in the room, but I just wanted to clarify. You mentioned that when we did the analysis of this case, so could you please just repeat who we consulted with when we made these decisions?
Right. So we consulted with the public health specialists from the from the MUHC. We also spoke to the public health authorities from the SISMO, which is our healthcare sector, and we spoke to them. I spoke to Dr. Colleen Fuller, who is one of our family physicians, and we're extremely fortunate to have her on staff. And Dr. Fuller actually is, I'm just going to double check her credentials here, but she is actually a public health and preventative medicine consultant. She also is a faculty lecturer at the Department of Epidemiology and Biostatistics and Occupational Health with McGill. We also have on our staff Dr. Annie Gauthier, who has a PhD in microbiology, and in her past life, before becoming a family doctor, she actually was in charge and ran a microbiology lab. So, I mean, and so those are excellent resources that we can tap into like in a fraction of a second. We also spoke to, I spoke to my colleagues, and those are some of our resources. The other little point that I want to make, and so the details of the hours and the spread, that's already written, that you can already have access to that in my letter. The other question is about contact spread and community spread. And I think inadvertently we've caused a lot of stress in that. Community does not mean it's in your community. It doesn't mean that, the Kahnawake community was exposed. These are terms related to public health and epidemiology, meaning that the spread, so right now in the province of Quebec, there's no community spread. There's no community contacts. And what that means, and I'll explain very clearly to reassure everyone, is that right now, people who have the virus, we can trace their contact. So everyone who has the virus currently has been either contacted through travel to many destinations, or has been in touch with someone who has tested positive as a result of being in contact with someone who was positive. So these people can be found in our community or other communities, but that's not community spread. Community spread is when you have an individual now who you can't trace, you can't trace, they had a contact, like who was their contact? We can't trace it. There was no contact with anyone anywhere that we have identified as being infected and potentially having inadvertently spread the disease. So that's a very clear distinction. So community contact means community spread where you can no longer trace the original contact. And that's an extremely important distinction. For example, in Vermont, they do have community spread. And that means that they have people who are positive and they can't trace back to who they may have been in contact with, and that's because of a breakdown in their testing. Well, that's my personal opinion, but it seems to be related to maybe not providing testing to people who had mild symptoms, thinking, well, they're mild symptoms, it's not a big deal. But it's actually anyone who has any kinds of symptoms has to be tested. And that is the cornerstone of the success in Korea. And that's really important. So any person who has any symptoms, again, who may have a travel history, if you have any doubts, call that number, because they will tell you exactly what you need to do.
Dr. Jones, can you
Yes.
please let us know if a person is contagious while they have the symptoms?
So you are contagious. So we think they're contagious, a few hours, maybe a day before they actually have their symptoms, and they are contagious for the duration of their symptoms. Once their fever is gone, the cough is gone, they feel better, they are no longer considered contagious. But we keep them in isolation. We don't kind of let them loose. They have to have a negative test, and after 2 days, they have a second test. And you have to have a sequence of 2 negative tests before you can now then be released and be taken out of your isolation. So, for example, I don't know if you guys remember, but that there was a particular man from Quebec who caught the virus on a cruise ship, and he was so happy that his test was negative, and his wife had prepared the bags, and they were coming back to Quebec. And 3 days later or 2 days later, his test was weakly positive. So he said, no, you're not going anywhere. And he had to wait for 2 sequential negative tests, and I don't believe he's home yet. So that's really important. Once any positive case that is going to be seen, or any suspect case is going to be taken under the wing of the public health department and are going to be followed, and everything is going to be in place to limit the amount of people who will potentially be spread. All right. The other point I want to clear up about my letter was we said that there was no need for contact tracing. So contact tracing means, I'll give you a very clear example people can relate to easily, chlamydia and gonorrhea or syphilis, which we start seeing again. So that person who has that disease, that we have a positive culture, we have to reach out to their contacts. So that's what contact tracing is. And unfortunately, people thought they're not going to call the people or find out. So that's not what was meant by that, and I do apologize. We are in fact going to have a nurse who also was working on that same day, who also was working alongside this particular physician, and she will be contacting every single person that was seen that day, and to reassure them that there is absolutely no reason to be worried, although we understand that is very worrying. And so we are going to be doing that. And as we speak, the clients have already started to be called. And I just want to say, I know that people felt that this person acted maybe irresponsibly. On the contrary, I have to give my hat off to this physician. To me, she's a hero because she acted appropriately at the right time. The minute that her partner had symptoms, mild symptoms, she self-isolated herself and her family. She did not come back to work here or anywhere else. And so that was paramount. That was absolutely important. And in the terms of when his symptoms started, they started more than 48 hours of her having worked at Kateri. At Kahnawake. So if we use the same logic and went back 48 hours, we're still in the clear. All right, so that's so important that message gets across, because I think it's very anxiety-provoking. But in this circumstance, I have absolutely no doubt that she was not infectious when working at Kateri. I have full confidence.
Dr. Jones, I just want to make a clarification because I did see some of the comments on the feed yesterday. So we almost lost the microphone. In Kahnawake, we asked for self-isolation within for public service workers who had traveled and returned as of March 12th. So it's important to make that distinction. Anyone who returned as of March 12th or later was put in self-isolation for 14 days. And this was the same recommendation that was made across the province for reasons because of the best information and science that they had as of that date. Prior to March 12th, every single employee was vetted and questioned, and measures were put in place whether they should stay at work or not, or go home. And it was based on contact in the high-risk areas such as France, Italy, Spain, all those countries that are mentioned on the World Health Organization site. And so measures were put in place that for anyone who came back before the 12th, that they were to monitor, and as soon as they would have symptoms, if they did, then they would go home immediately. So those were the measures that were implemented, and that is what was followed by this physician. Since this case, we are being extra cautious, and in fact, in Kahnawake, we're the only place where we're going to implement this change. We're actually going to go back as of March 6th. So this is something that we'll be implementing today, that will look at public service workers who returned as of March 6th and ask them to finish their self-isolation. It may only be 1 day, it may be 2 days, but just to be on the precautionary side, this is a new measure that we'll be implementing today, that was discussed just a little bit before the press conference.
And I would like to follow up with 2 comments. So we made decisions on March the 12th, and we made decisions based on the information that we had at that time. Many hospitals across Canada did not implement this ban of automatically going into isolation as of March the 12th. This is a Quebec initiative, and it's now being applauded because BC stated today that they were going to start putting those measures in place. But you know what? The horse is out of the barn. And so for us, we implemented that. And not only that, we consulted with the Jewish General Hospital, which in my opinion is one of the best hospitals in Quebec. It has one of the highest standards. And on staff, they have Dr. Weiss, who is a well-known, internationally well-known a infectious disease specialist. He's been on the TV, in French and English TV, I think probably on a daily basis. And so we looked at their protocol and we implemented the same protocol, and we went one step further. We asked these particular healthcare workers that had traveled within 14 days of the March 12th to wear a mask. That was an additional measure that we put in place. And the second point I want to make is this. This virus is evolving. What decisions we made Friday are not the decisions that we're going to be making today. And the decisions we're making today are not going to be the decisions that we're going to make tomorrow and in 3 days or next week. And it's not because we don't know what the hell we're doing, it's because we do know what we are doing, but we're having to adapt. Like these viruses are very smart. They adapt to our defenses, we have to adapt to its behavior, and we have to adapt to our contacts. So, so I think it's important for people to understand that we can't keep going back and say, well, why didn't you do this? Well, because it didn't make sense at that time. It makes sense today, but you can't go back in time. And so, we need to start fresh. We need to remember to stay in the present and keep looking towards the future. So I think those are really important messages.
And Dr. Jones, just one little point is that we want to reassure the community we are staying up to date. On a daily basis, we're reading every single material that's sent to us, and every hour there are many, many documents coming from the provincial side, the federal side, from World Health Organizations, from the orders of nurses, from the orders of physicians. There's constant information. Everyone, as Dr. Jones mentioned, across the world is keeping up to date. This is a world health concern, and we're very up to date and, in fact, very advanced in the measures that we're implementing compared to other areas.
So, in full transparency, we have another physician who had traveled to the Middle East, and so on March the 12th, she called me up and said, well, geez, I just came back a few days ago. What should I do? And had she come back from New York, I would have said, well, no problem. There's just 1 or 2 cases. You have to remember the time now. Maybe you would wear a mask. Yes, because it was outside Quebec. But she had come from two different Middle Eastern countries, and she had transitioned through one of the airports in Germany, and so she's on self isolation, and she will be ready to come back on Monday. So it's working, and so I think that was very important. That and we have nothing to hide, and I want the people to have as much information to feel reassured. We know what we are doing. Let's see now. I just wanted to make sure I cover everything, and I added a few extra notes. Now, the situation in the United States is evolving quickly, and so I think so that is a bit of a concern. It's also evolving quickly in other provinces as well, and it's evolving in the province of Quebec as well, but maybe not at the same rates. At least I don't know if you have the most latest stats, because I didn't get a chance to get to it in terms of numbers.
I don't have the numbers for this morning, no.
Okay, so maybe you can look that up while I'm going to continue with this. So on Friday, on March the 13th, right, so the day after the public health authorities and the Minister of Health and Mr. Legault started at that date and said, from this point on, anyone who comes into Quebec from any place outside our borders, you should go into self-isolation. There's no question about that. As of March the 12th, you have to do that. And the community are asking me, well, how come you're letting your healthcare workers before March 12th? Now that we know what we know, and I'm going to pose the question back to the community and to the community members. We are fully aware that there are community members who did travel back and forth to our sister to the United States, who have traveled to and from Ontario since March the 6th and since March the 12th, who are not practicing social distancing, who are not practicing self-isolation, And that's the weakest link. And I want to preface what I'm going to say that I have utmost respect for iron workers, for the trades people, men and women who, make a decent living, who have helped to build our country and the United States. This is no disrespect to them or to any other person who comes and goes across the borders. That this is our weakest link in this community, but in my community in Brossard, in Montreal, is that young people, mobile people, think this is no big deal. And they're right. For them, it's no big deal. The big deal is this. 80% of people will have mild symptoms. The problem is that 30 to 70% of the people can get sick. Now, I hear, well, the flu, people die, some die, and more people might die from the flu than will die from this virus. And what's the big deal? The big deal is this. The flu is a disease or is a viral infection that starts in the fall and goes on for 6 months and finishes in the spring. So we're talking about 6, 7, maybe 8 months. The problem that we're experiencing with this virus is that a lot of people are getting sick at the same time. And so the experience in Italy, worst case scenario, they had 500 deaths today. I mean, I was absolutely devastated when I got this news, and I might get a little bit tearful, but hear me out. They are at a level 4, and I'm sorry I didn't get a chance quite to read the exact definition, but a level 4 pandemic. So that means that emergency army measures are now being in place. And this means this. There are not enough respirators to go around. Well, there weren't enough respirators to go around 2 weeks ago. But now the doctors are having to pick and choose, and they're taking people off respirators because the likelihood, or they're too sick. So anyone who's too sick, who's been on a respirator, not turning the corner, I don't know how they're going to make those decisions, but it's heart-wrenching. We're not talking about old people, which, youth, which is not right either, but, they've lived their life, and it's easier to accept that an 80 or 9-year-old, okay, well, you know what, they had a good life. But they're seeing now people in their 60s, in their 50s, and in their 40s, and the occasional children. Not common, it's rare. So they're going to have to make decisions. And you have to remember that these patients are also going to be in competition with your heart attacks, your strokes, your patients who need an ICU bed because they have a acute illness. So if you imagine the pileup that we had a few weeks ago now, when we had those 200 cars that got piled up, imagine if that situation happened in Italy. There's no way in hell any of those people would have been rescued, or they would have gone into the ICU because there are no beds, there are no respirators. In the province of Quebec, Madame McCann, who is the Minister of Health, is putting in place 1,000 additional beds. And they're going to be opening those beds up. They're reorganizing all the services. As people know, the majority of regular appointments, non-urgent appointments, follow-up appointments are being canceled. Our cancer patients will still have their appointments. Our patients who need chemotherapy or who need radiation therapies, depending on their treatment and where they are, those are going to continue. But all the other beds, all the other services are going into this action plan. It's an emergency action plan to provide more beds. The Jewish General Hospital right now has 80 beds, and they're proper isolation beds. And we hear fluctuating numbers, 3 to 5 people that are in these beds. I believe there was one person that so far that has been cured and has gone home or is maybe waiting for the final results. So I just want people to imagine, across Canada we have 5,000 respirators. So, if even 10% of the community gets sick, well, you're competing with 10% of the rest of Quebec and Canada. Imagine, because none of us have seen this virus, 30%. So in Kahnawake alone, you might have 3,000 people who are all sick within a short period of time. That's the problem. That's the problem. And is the take-home message I want people to leave. I don't want to be alarmist, and I know I might be freaking some people out, but I think this is serious business. And on Friday when we had our general meeting that was chaired by Lloyd Phillips, and I was making some strong statements, there was some skepticism around the table. Are we overreacting? This is like exaggerated. Why should we go into isolation, and why should we be canceling everyone's visits and holidays? It's people need to take their holidays, and well, no one's skeptical anymore, and so people, I made some statements. I made a very unpopular move, and at the time, people thought, well, geez, she's a little bit hysterical. You didn't tell that to my face, but I'm sure that kind of went through their mind. I'm not hysterical anymore, am I? Huh? It is what it is. We have no choice in this. We have no choice in this, but we have some choices. And I think when people have anxiety and depression, it's a sense of loss of control. We have no control over this virus. We have control how we can protect ourselves. We can control, make some little notes. There's something that we can definitely control. And that will help to reassure a lot of people's anxieties. What do we have control over? We have control over each one of us in our communities who have a friend, a relative, a neighbor, a casual contact, a Facebook person that we know, and that's our generation, a Snapchat person you might know, or whatever else people are using for communication. We each have that responsibility to say, hey, didn't you leave the province? When were you away? You were away after March the 6th? What the hell are you doing here? Go home. Isolate yourself. Why are you putting my life at risk? I have a grandma. I have a dada. I have an elder. I have a person like me. I'm a transplant patient. I was blessed with this gift 5 years ago. And there are community members who I'm very fond of because we had our transplant around the same time. It's very personal, and I have no problem sharing about my personal life. But this is it. There are transplant patients that are in the community, and we had our transplant together. And we meet sometimes in the waiting room. We have the same specialists, And so, sorry, I got a little emotional and I lost my train of thought. But so I can't afford to be in contact with anyone who might have been to New York or Ontario or Hawkesbury or Cornwall or Akwesasne, your sister community. It's not. I wish it wasn't like that, but I can't afford it. Your elders can't afford it. People with chronic disease, they can't afford it. They're at high risk. So that's really important. That yeah, they're not going to get sick. My husband won't get sick much. My kids probably won't either. But if I got the virus, it might be the end of me, and that is my reality. And I'm not the only one with that reality. And what we're starting to see in Italy is that, geez, what's wrong with this picture? They're starting to see 40 and 50-year-olds. We don't know if the virus has mutated. So remember, viruses are smart and they adapt. They can't adapt much, though, because we have no medication. There are no antiviral medications right now. There's no vaccine on the horizon right now. We hear a lot about stuff in the U.S. or Cuba or whatever. We have to wait and see, and if what we see is true, that's going to be help. But there's no proof, absolutely no proof or guarantee that anything that you're seeing on the website is working. It's not working. Look what's happening in Italy. I'm sure that they tried everything. They're trying everything. So I think that's an important take-home message. So what do we have control over? We have control over what we do, where we go, who we see, and those people. So I'm talking directly to these people, again, out of no disrespect, but really, you are the weakest link. In my community in Brossard, everywhere across this nation. If you're not listening and you're not changing your behavior, you're putting us at risk. This physician did not put us at risk. She acted responsibly. She acted immediately. She notified us as soon as we had the information. And I know it caused panic, but this is your wake-up call. You have to listen. You have to listen to every recommendation that comes out of the Kahnawake COVID-19 Pandemic Task Force. The people that are at this table, they give a damn, and they are working tirelessly to protect you. But if you don't help us, we're going to lose this battle, and we're going to end up like Italy. And I don't want to see that day. Like, I just can't. I don't want to lose my elders. I don't want to lose my parents. I don't want to lose family members. And you stand to lose your elders, your natural Mohawk speakers, your history, your culture. You stand to lose. It's just too much. It's a bit overwhelming, and I will compose myself. But that's what we're talking about. We're not talking about, geez, the one that has a few symptoms, 3-4 days, big deal. I don't care about you in the sense that that's not what we're worried about. We're talking about our elders. We're talking about our people with chronic disease. We're talking about people that are valuable in my community, but they're valuable in your community. So we have the choice. That's the choice that we can make. The other choice that we can make, and the concept about self-isolation, there's lots of opportunities to look that up. But essentially, self-isolation is you're at home, you're in a room, the door is closed, you're not in any physical contact with any of your family. It's not, oh, I'm staying at home. This is like a snow day, I'm going to call my friends over, or we go for a walk and we'll meet afterwards and we'll have a few beers. No, that is not self-isolation. That's not what this is. And this is what happened in Italy. They said, oh, well, geez, we got a break from school. We got a break from our work. Let's meet up out to the beach. Let's go for drinks. Let's go into the restaurant and have some tapas. Well, you know what? They're screwed now. So this is really, really serious, okay? So you have to listen. And I know it's hard. It's going to be very hard. But if you think this is hard, this is just the tip of the iceberg. Just the tip of the iceberg. Believe you me, in 2 or 3 days, we're going to be having a different conversation. Next week is going to be an even more different confrontation. But you have some control over the rate of spread. So why that's important when you talk about flattening the curve? Listen, basically it's when you have the flu, it's spread over 6 months, 7 months. If you have 1,000 people that get sick over that time, you can manage. We have systems in place. But if you have 1,000 people get sick within a month, it's going to be hard. But if you have 2,000, it's going to be harder. If you have 3,000, geez, it gets difficult, But if you have 5 or 6 or 7 or 10, or, we talk about potentially 70% of people. So the Chancellor of Germany was on with, today was making some statements, and she said, you know what, guys, we're in for this. It's not going to be 2 or 3 months. It might be a year. It might be longer. And she expects that up to 70% of her German community is going to have been exposed and will have had this virus. The good news is, once you've had it, we think at this point, and again, we're not sure. It's like once you've had it, you might be immune. But we are not sure, because some viruses you get it once and you can get it twice and you can get it 3 times, but they're not deadly viruses, so it's not a big deal. And again, this virus is not that deadly. It's the numbers and it's the timing that is the deadly. That's why it is so deadly. So I think people have to respect themselves, and they have to respect all of our community members. So, for example, the hospital, I keep saying to people, to my staff, because they're worried. I said, you know what, this is the safest place. We have security at the front desk who screens every single person coming and going, who screens every single worker coming and going. They went out for lunch, they went out for this, for that. Oh my God, he's asking the same questions again. I'm tired of asking the same questions. But you know what? We have to. Because I don't know if you went to the corner store and that person came back from New York yesterday and maybe, or came back from and maybe picked up this virus a few days ago, I don't know. We do not know. And so that's why we keep asking this question, because the question about travel is going to become obsolete. The question is going to be, Have you been in contact with someone who is under investigation, i.e. waiting for tests? Or have you been having contact with someone who is positive? It's a matter of time, right? So yes, we're going to keep asking those questions. Every staff person that comes and goes washes their hands, puts on Sterigel, have a change of clothing. We have strict policies about where people are coming and going. We're going to be changing things again in terms of our pharmacy entrances. We're going to be changing in terms of staff entrances. I can't give you the details because it's going to change tomorrow again. And people say, well, geez, like why? Well, because we have to adapt to win this battle. So the other question is about social distancing. So social distancing is different than being in isolation because, again, in isolation, you're essentially become a hermit. And those are because you are at risk of spreading the disease. Social distancing are for the rest of us who have had no travel, no contact, but we want to keep ourselves safe and we want to keep others safe. So social distancing is, okay, I can be around people, but I have to have at least 2 meters away from them. So I have to be like a table length away from them. I have to not shake their hands anymore. I can't kiss them. That was a downfall of the French and the Italians. Well, this is how we are. We have to touch. We have to kiss. That's who we are. We kiss 3 times. Up until 3 days ago, Parisians were still having cafes on the terrace. They were still gathering at the Champs-Élysées. They were still, we're not doing that. You shouldn't be doing that. So those are some of the measures. If you have to go shopping, so think about it. A few, last week or at the beginning of the week, it was like a mad zoo at Costco. And Costco is a good store. It has nothing to do about Costco, but you can see pictures. Well, you go there now, you have lots of room, lots of space. You're cleaning. You have to clean your hands. That's the perfect scenario. If you want to go to the clinic, we're going to space out your visits. We're going to put you in dedicated spaces. Each hospital is doing that. We've asked the restaurants to close, but you can do your takeout because that way you're limiting different exposure. So there's also concepts about work social distancing, and those are all found on our web pages, and I could summarize where they are, or maybe Lisa could summarize that towards the end. So those are really important concepts, So in my situation, I stopped working on Tuesday, and I went to my appointment yesterday, and I'm not going out anymore from this point on. My parents live away, and I'm going to have my daughter set them up on how to use Skype or whatever, so that we can actually have some FaceTime together, like I'm doing with you. And that's good. That's safe, right? So I want to keep them safe, and my family, they are keeping me safe. So my daughter, who's in isolation because she's a healthcare worker, she's a surgeon, and she has to be quarantined for 14 days. So we wanted to drop off some stuff, so I could see her from here to her window. We waved to each other, we sent kisses, and then we started crying. But you know what? That's okay, because she's in a good place, and so am I. And when she goes back to work, I know that she will take care of herself. So those are important points to sort of kind of remember. So we dodged a bullet. But this is a wake-up call. And my worry is about, sorry for the analogy and the Mohawks and guns, but it has nothing to do. It's just a reference. We dodged a bullet, but there's some loose bullets in the community right now. And if you're listening to me, you have to take this seriously. And if you're not listening to me, well, listen to your grandma. Listen to your sister, listen to your friends, because you're potentially putting people at risk if you do eventually get this disease, and you're going to have their deaths on your conscience. I know those are strong words, but Mr. Legault, and I do refer to him because I think he has managed this situation better than any of the other leaders in this country. and he said, oh, I lost my train of thought now. But he's really pleading for people to listen and to follow these measures. So when we started meeting on Friday, I knew we had this window of opportunity to, put things into place, get the message out and that, but the window of opportunity is closed now. It's done. So, there's no, I don't feel like it. Well, I don't care. I don't care. You have to listen. You have to do what the task force is telling you to do. They're making hard decisions. People are working till 12 o'clock at night. They're working over the weekend. The education center, setting up babysitting, working with our daycare people to provide services so that the healthcare workers can continue to work. But the healthcare workers are not immune. So, it came to my attention today that we had a visitor to the hospital in the last few days who lied about his travel. We found out after the fact. He lied at the door because he wanted to have services. If that person comes down with symptoms and doesn't get tested, or does come down with symptoms and decides to get tested, you know what the consequence of that is? We're closing the outpatient department services because I had to put off every person that he came in contact with. One individual. And you know what? In I can't remember exactly what country, but my husband, he kind of keeps me up to date and stuff. I don't know if it was in Korea or China. I believe it was in China. One individual, one lady, infected 1,000 people. One lady infected 1,000 people. She took public transportation, I believe. She was at the market. She attended a funeral. Right? So you see that kind of ripple effect? So one individual who's acting irresponsible, you're not just a loose bullet anymore. You're a loose cannon, And I'm sorry again for these analogies, and I apologize if I offend people, but I think it's the message that is important. It's not the words, it's really the message. I think I've said enough. We will be putting some references on our website. Dr. Gauthier has reviewed the literature for me. She gave me some update information, and I also contacted my kidney specialist about a few things that are circulating that are bogus. So, for example, about the different medications. There was a concern about people who are on certain classes of medication. They're called ACE inhibitors or ARBs, things like, and I don't want to name names because I don't want the companies to come after me, but, many people take them. I take them. People with blood pressure take them. People with diabetes take them, etc. And there were very clear statements made by the American associations in hypertension and cardiology and renal failure, etc. And so I have the exact quotes, and we will post that there's no indication at this time to stop taking those medications. The other thing that she let me know was that a little bit of good news. That this is a virus that has an envelope, and as a result, it's easily killed with alcohol as well as soap. So, wash your hands, wash your surfaces, wash. The other thing is we tried to find that reference about this coronavirus, COVID-19, and this period of being contagious 24 to 48 hours. We can't find it, so I think that the reference was made because of other coronaviruses. Oh, and one last point. So there was some question about children being immune. So children are not immune, but anyone who has kids that attend daycare, who go to pre-K, who are in kindergarten, the first year that they're exposed to other kids is hell, right? You have a cold you finish one and you start the next one, and it's normal to have 9 to 12 colds between September and April. That's normal, but they're coronaviruses, right? So these kids have had recurrent experiences with the coronavirus, as well as their parents, and maybe their grandparents, because they babysit them a lot. So we think that that gives them a bit of an advantage in that it's not the same virus, but it's like a cousin. So it kind of remembers it a little bit, and they can build up a good immune system. So, us that are a little bit older, that's not the case anymore. And if you remember the pandemic in 2009, what was different compared to the Spanish flu is, the Spanish flu, it didn't discriminate against age, but the flu generally, older patients are oftentimes sicker. But with the pandemic that we had in 2009, older patients actually didn't get as sick because somewhere in their lifetime they had been exposed to H1N1 or components of that, and so they had these reserves, they had a memory. And so that was kind of really interesting. In this particular virus, no one has a memory, but children can build good responses in young adults, and they're frequently exposed, so the immune system's always kind of being revved up. So there's a little nuance there. So they're not protected against this specific virus, but they're better protected in some ways than maybe I will be, because my immune system is turned off, right? So people with transplant, people who are on medication to lower their immune system, their immune system, when they're on, it's like turned off. And if I stop my medication to be able to fight the virus, well, then the immune system is going to attack my little kidney that I'm very fond of. Huh? So people have to think about that. The other little pointer that she brought up now was that some people were wondering about, well, how long can it last on surfaces? So a very interesting point. It says that so coronaviruses, not this particular virus, but coronaviruses can last up to 9 days on metal, glass, and plastic. It can, in this particular virus, sometimes when people cough and sneeze, it can actually persist up to 3 hours. So when people, I'll rephrase that. When our healthcare workers are doing procedures, if they're doing intubation, if they're doing treatment, so we're talking about people that are usually quite sick and might be on a respirator or intensive care unit. In those situations, it can stay suspended in the air for up to 3 hours. But outside of those circumstances, it's not suspended, right? So not to worry, and that's why we know it's a droplet. We have that kind of space. The other little tidbit was that it can spend up to 4 hours on copper. And I mentioned that because some healthcare facilities who could afford it have copper taps and things. So we thought that was better for infection control because it doesn't last as long as it does with our stainless steel, but it still lasts up to 4 hours. It can last up to 24 hours on cardboard. So you know what? That to me is a little bit worrisome too, because we get a lot of our food that's delivered, in cardboard. But on plastic and stainless steel, I correct myself, plastic and stainless steel, it's 2 to 3 days, we think. So, so clean your surfaces. If you clean your surfaces with plain old dish soap, it's going to take it away. It's going to kill it. So that's important. One important message was about anti-inflammatories, things like Motrin, ibuprofen, Advil, any of those kinds of medications, Aleve. We're recommending, the WHO is recommending that because there's not much evidence, and I can give you the article if you want to read it. It's recommended that people not use these types of medications for symptoms. The French doctors seem to have seen that there are worse outcomes in patients who are on that. And there are no treatments, there are no antivirals, which is different from the flu because we have antivirals that do work. So during the pandemic, people from the community got Tamiflu, and I personally believe that 2 patients from the community died during that pandemic, directly related. And so, but despite our best efforts in having those medications available, etc., and then the antiviral and the vaccines. anyways, a whole bunch of medications, they're not working. What's interesting is we don't quite know yet, but there's some question about children who might have been infected if the virus might be shedded through their stools. And so the information is not in yet on that. And so, as the information becomes available, you will be made available. I think I've kind of overdone my time here. I apologize if I was emotional, but I think it's important for people to realize that for the most part, people are going to recover. The great majority of people are going to recover, but you have to remember who might not, and you have to be responsible. And I thank you for this opportunity. We will be doing this on a regular basis, and I don't know if Lloyd or Lisa have anything else to add, and if I made any incorrect statements, they will be corrected, because sometimes I get carried away, but it's because I care. I do love this community. I have devoted 33 years of my life. I have spent more time with you than with my family. Remember that. You are my family. And so I think that's important. You are important to me. You're important to our doctors, our staff, our nurses. And I want you to be safe. I don't want to make your life miserable, but I have no control over that. So you have to listen. Anyways, I'll give it over to Lloyd and Lisa.
We're all crying here.
Oh.
No, I'm.
Object.
I know. Well, maybe.
The good news is we can do some things. We can choose how we react. When I have patients with anxiety and who have depression, they have no choices. But here you do have choices. You have control over how you behave. You have control. You have control to take the precautions. You have control to call that number, 1-877-644-4545. You have those choices. You have access to information. Get informed, stay informed, and do what we say. For God's sake, just do what we say. I'm not a God-fearing or believing person, but you know what? For God's sake, for your sakes, for the Creator's sake, for your community, for my communities. I know that other people are listening, not just people from this community are listening. People across, our local communities in Chateauguay, they're listening. It was a bombshell, and if you're listening, I hope you get the message. And please, please, please follow the recommendations.
Thank you.
Yeah.
Thank you, Dr. Jones. Go ahead, Lloyd.
Thank you very much, Dr. Jones. I think if the message wasn't clear before, I think it's certainly clear now on what we're currently dealing with and potentially dealing with in the future, and clearly why certain measures are being taken to ensure that we don't see certainly our community or the whole province or country go down the same path as we've seen happen in Europe and in Italy and sorts. So it is certainly an emotional time for everybody. I can't say it much more clearer than Dr. Jones had just put it and made it very personal to her, and how she dedicated a significant portion of her life to Kahnawake and how much she cares for this community. And I think everybody who is on the Kahnawake pandemic COVID team is equally emotional, equally vested in ensuring what we're doing is best for our community, and we'll continue to move in that direction. And again, if further measures are required to ensure public health and safety, those measures will be taken based on the advice of Dr. Jones and her team as well, and her colleagues. So again, I thank you very much, and I don't know if you want to have a time for a couple of questions, just to since the media is here, and we'll do our best to answer those for you.
Dr. Jones, some questions about medications. You had mentioned the painkillers, but what about diabetes medication? What about high blood pressure medication, and how it reacts with this virus?
So I have the reference. Just give me a second. So in terms of medications, the only one that we have concerns over right now are the anti-inflammatory medications like ibuprofen, Advil, Aleve. Tylenol is safe. Okay, so Tylenol is safe. Acetaminophen is safe. That is very, very safe. It's the anti-inflammatories that you need to be very cautious about. In terms of the ACE inhibitors, so for example, I take Altase, I was on Covercell, those are very commonly used medications. There's no indication that it increases your risk or the duration of the illness. Again, that is the information that we have. It was based on information that was collected based on the experience in China and elsewhere. We think that there might be a racial component to some of these receptors that we already have in our lungs, and it was theorized. It was a theory. Oh, okay. Well, geez, maybe these medications put us at more risk. But the studies that have been looked at so far do not conclude that at all. So I have no problem today to say there's no reason to change your medications whatsoever, unless your own doctor has different reasons, and the doctors, they can reassure you as well. I will put that reference on our webpage, and specifically Dr. Gauthier. So she's, I know that she didn't want me to quote her directly, but these are not her quotes. These are from the studies, and it's coming out of the Lancet. It's coming out of. There were some position statements that were made by the American and the European societies for hypertension. I spoke directly with my nephrologist, and she reassured me, and she actually sent me some other links with the position statement. So I have no worries, I have no qualms, and I want our diabetic, hypertensive, renal failure patients, anyone else who's on these classes of medications to not worry. If you have questions, you can ask or speak to the pharmacy, but they should be giving you the same message. There's no need to change anything right now. Okay? Yeah.
Thank you. We'll put the references on the website.
Commissioner Phillips, for those that are at home in the community and that are beginning to be worried about their economic situation, is there anything that you can say about that?
Well, right now, we are looking into all options in terms of how we could best support individuals who are in isolation or people who are may be impacted in the future. As you've seen, there were some governmental programs that were released by the federal government yesterday, and as well as the provincial stuff. We're looking at those, but we're also looking at something on what we could do internally to Kahnawake to help alleviate some of that financial stress and anxiety on individuals. So we don't have anything yet, but there's certainly a lot of work again happening behind the scenes. There's a lot of people involved here who are not sitting at this table, who are doing work, researching and pulling stuff together.
We know 30 to 70% of the population will be affected by this at some point over the next little while, and that's the whole idea of flattening the curve. If somebody were to test positive, and they're in that age group or in the population sector where it's not going to be you're not going to be severely affected, how long would somebody expect to start feeling better? Do we know that?
So I think it's like it can vary. So the person that has mild symptoms is going to be like 3, 4, 5 days. The person that has a bit more severe symptoms is like the flu. So those of us who've had the flu, one of the questions I ask patients, do you feel you've been hit by a Mack truck? Yeah, okay, well that's what the flu is. The people who end up having to be in a hospital, they're sicker. And those that have to go on respirators, they're often sicker, and they're in there for a long time. So I think that depending on your age, I think the average length of stay for people who go to a hospital and have to be in a hospital is about 7 days that they have to be in a hospital for hospital care. They still have to be in quarantine though until their serial tests are negative. So, there's no one answer fits all. It depends on your age, it depends on your risk factors, it depends on how sick you are, and yeah.
Dr. Jones, from what we're seeing, the numbers are obviously all over the place around the world now, but the recovery rate between 90 and 99% at this point for this. What about the chances of contracting it once you have completely recovered and tested negative twice? Can you contract it again, or have you built up enough antibodies in your system?
So we don't have the answer to that question. I think we're going to see maybe post China and Korea what their experience is going to be like, and what's happening to those individuals. We do not know, because if so that's I'm not going to give you hypotheses. We don't have an answer. We think yes, but we are not sure, because this is the first time that the world is experiencing a pandemic with a coronavirus. All previous pandemics have been a influenza virus. So this is brand new information. This is brand new behavior, brand new virus. There are many unknowns, but we do know a lot. So I don't want people to think, oh, they know nothing. Well, we know a lot. There's a lot of information, and as I'm saying, people are sharing information. They're not hiding information. The Chinese have been, after the initial concern, about them maybe not being coming forward, but since then they have been collaborating with all countries. They are lending support. They are bringing respirators to Iran. Iran is another situation, well, I'm not going to make any political statement about that, but they don't have access to masks and gowns and gloves. Last count, 14 doctors died, right? So, but that's another story. But yeah.
Based on the information that's currently available, are there enough tests in the province right now, considering the situation in the States?
So that's an excellent question. And so, and I don't have the exact numbers for you right now. So, and I'll answer this in two ways. So, my first answer would be yes. The appropriate people who need to be tested will get tested. And I know that, on Friday they had one test center, which was at the Notre Dame Hospital. By Monday there were 9. By the end of this week, I think it's 22. And then by next week, it should be 31. So that's a lot of centers. And a lot of people are getting tested, and we do have enough test kits. Now the question is, if you have no symptoms, there's no point in testing. So, don't call and say, oh, geez, I want to get tested, because now I heard that, Dr. Jones thinks that maybe there's someone in the community. They're not going to test you, because we have to keep those tests to identify the right people at the right time. If you have a cough or cold symptoms, etc., and there's a concern for having been in contact, you will get tested. And I know there was a lot of frustration at the beginning of the week when people tried to call. They were getting cut off, or the phone lines were not working. That's no longer the case. We have our own personal experience of being able to get through. Maybe not so timely in some circumstances, but at least within half an hour to 45 minutes, or even less, and that's going to continue to improve. The Minister of Health and Mr. Legault, and our Public Health Minister, Dr. Ruda, and all the other ministries are working to provide as many tests as possible, as many test centers as possible, and so I'm confident of that right now. The problem in the States is that they don't have they were not providing tests. The situation in Vermont, if I'm remembering hearing a talk show, was there was a individual who I believe had been in Italy or had a concern about potential exposure and mild symptoms, and kept asking to get tested and was continuously refused because they were only testing people who had more severe symptoms. Well, now they have community transmission, meaning that they can no longer trace their index case. And that means that there are people who are walking around in Vermont who don't know it, are going to get sick and are going to be affecting a lot of people. And so I think state-wise, the states have fantastic healthcare systems for people who have access to it. And people were having to pay for their tests. That's a different reality completely. I know that in Ontario they were putting in place, if not, they might have already started some drive-through testing. But again, it's not going to be like McDonald's where you can go. And I'm sorry if I reference to McDonald's, but it's not like a drive-through where you willy-nilly, I want to test, I'm going to get it. No, there has to be some reasons to get tested. At this point, once the virus moves into our communities, once the virus is more widespread, and it's not if, it's once it will be, then we will all be at the same point. We'll all be on the same playing field. It's going to be, well, we can't trace people anymore. We have to assume if you have these symptoms, you might be carrying or you might be having this virus. We're not there yet, and we want to postpone that eventuality to the future. So I know it's a long answer, but so it's yes.
I think with that, we'll call an end to today's session. I want to thank everyone that tuned in on Facebook Live. I want to thank the media for coming today. And stay tuned. Keep an eye on Kahnawake 911 on Facebook. Check our website, covid-19.kmhc.ca. Stay up to date with all the most up-to-date information, trustworthy information. And let's work together and keep the circle strong and stop the spread of COVID-19 in Kahnawake.